Every year, there are about 12.2 million new strokes globally, approximately 1 every 3 seconds. About 1/3 of stroke survivors suffer from moderate to severe disability, resulting in significant physical and mental burden to stroke patients and their carers. Timely and adequate rehabilitation is critical in facilitating post-stroke recovery.
Recently, and as part of our World Stroke Organization Future Leaders Program project, we conducted a global survey on the status and barriers of stroke rehabilitation.
Amongst 526 responses from healthcare professionals across 63 countries surveyed, rehabilitation services were only available in 33.5% of potentially eligible stroke patients and as low as 22% in low-middle income countries.
According to the global survey and rehabilitation that we conducted, we identified a number of barriers related to conventional rehabilitation. 59% of the respondent sites reported limited access to rehabilitation and post-discharge care.
42% had a lack of trained rehabilitation professionals, and also 40% mentioned that the patients also had a lack of awareness of the importance of rehabilitation.
Telerehabilitation improves patients' access to rehabilitation services. However, our survey revealed that 29% of responders had not heard of telerehabilitation, and only 15% of responding sites offer telerehabilitation.
The top barriers and challenges to implementing telerehabilitation include lack of suitable electronic devices, limited internet connectivity which lead to poor quality of the sessions, lack of clear guidelines and protocols, and lack of suitable personnel to facilitate telerehabilitation at home.
SmartRehab was designed by a team of academic neurologists, engineers, and therapists, and currently encompasses a wide range of exercises, specifically designed and catered for patients with neurological disorders. After detailed assessment by therapists, they can prescribe appropriate exercises and monitor their performance using a web portal. And patients can then continue with their rehab at home using SmartRehab. In contrast to traditional telerehabilitation platforms, SmartRehab utilizes AI technologies to evaluate one's exercise performance using objective measures, with real-time feedback simulating an AI therapist in place to instruct and correct one's movement. Currently, and as part of a World Stroke Organization Future Leaders Initiative, the feasibility, acceptability, and usability of SmartRehab is being tested in several countries, including Hong Kong,
India,
Italy, Romania,
Argentina,
United States of America,
Malaysia,
Porto Alegre, Brazil.
Most of my patients that use SmartRehab found it to be easy to use, reliable, and useful in their rehabilitation journey. The feedback is clear and they enjoyed the pleasant platform. Overall, they were satisfied and showed eagerness to continue using this in the future.
Therapists have also found SmartRehab to be an accessible and easy-to-use platform that have benefited patients. The real-life compliance tracking functions are very helpful, and overall, they serve as a complementary aid to continued rehabilitation at the home setting.
However, while most therapists agree using the SmartRehab in their practice, some are concerned regarding the potential fall risk using the platform at home.
Others were concerned that the elderly may not be able to use the platform due to a lack of technological knowledge.
Some therapists would also like to see the further developments of such platforms, such as inclusion of lower limb and fine motor exercises and exercises that can be performed in supine lying position.
And others would like to have direct communication tools between patient and therapist while using the platform.
Our mission is to use innovative technologies to increase the accessibility and affordability of rehabilitation globally, especially in resource-limited settings. By shifting rehabilitation from the hospital setting to the patient home, we hope to facilitate patient adherence to the therapies and enhance functional outcomes. In the long run, we hope that SmartRehab not only can reduce the global burden and cost of disabling disorders, but also improve the quality of life of the many patients out there living with impairment.